So today I'm going to be performing the wound care dressing checkoff, and the first step is to say the 12 safety practices. So first I would verify the care and order of the client. I would perform hand hygiene before and after handling equipment or performing care. I would verify the facility's policy and assemble the necessary supplies. I would consult the manufacturer's guideline, and then I would knock on the client's door and identify them with 2 identifiers. I'm going to note the overall condition of the client, and I'm going to explain the procedure and provide for privacy. I'm going to raise the bed to promote good body mechanics. I'm going to don PPE if necessary. And then after I'm finished, I'm going to lower the bed and apply the side rails according to the client's care plan. And I'm going to attach the call light signal. And then any abnormalities I would report and record. So my first step, I'm going to put on my gloves, and then I'm going to remove the dressing that is on the wound. So I'm going to apply a little bit of tension to the skin just for some traction to avoid any kind of tearing of the skin. I'm going to remove the dressing away from the client's face so that they don't see, so they don't get queasy or anything. I'm going to remove the packing from the wound. And I'm going to observe the dressing. I'm looking for any kind of drainage or odor, checking to see if it's serous, serosanguineous, sanguineous, or purulent. So then I will fold it up and remove my gloves. Then I will discard. So I'm going to assess the wound. I'm going to check the location of the wound, the type wound, whether it's a surgical wound, a pressure ulcer, a trauma wound, partial thickness, full thickness. I'm going to also look for any drainage in the wound, any odors for there as well. Then I'm going to put on a clean pair of gloves. I'm going to measure it. I'm going to measure the length and width first, and I'm going to make sure I'm using the same measurements for both, whether that's inches or centimeters. This is a smaller wound, so I would probably use centimeters. I'm going to make sure not to touch the wound or any of the skin around the wound to avoid contamination of any kind. And then I'm going to take my Q-tip applicator, and I'm just kind of feeling around for the deepest point in the wound. And then I'm going to slide my fingers down the applicator, keeping it level with the wound bed. And then I will bring it up to measure it. And then I'm also going to be checking for any kind of tunneling or undermining. And if there is some present in the wound, I would use the same technique, find it, slide my finger level with the wound bed and measure that as well. And I would use the clock technique, whether it's at 12 o'clock, 3 o'clock, 6 o'clock, anything like that. So then I'm going to discard these as well. So then I'm going to go ahead and get my tape ready for after I apply the new dressing to the wound. So I'm just going to measure to see how long I'm going to need it to be. And for this wound it's smaller, so I'm just probably going to use 2. I'm going to go ahead and get my piece ready to put my initials, the date, and time. Okay, so now I'm going to open up my sterile field. I'm going to make sure to maintain my sterile field between my hips and my shoulders. So I'm going to start by opening away, and then to the sides I'm going to maintain my 1-inch border to avoid contamination. So I'm going to check the saline for the expiration date and just making sure I have the right saline and things like that. I'm going to put the label in the palm of my hand. I'm going to come around my sterile field and get my gauze wet. And then I'm going to step over and get my sterile gloving on. also maintaining the 1-inch border. So I'm going to start with my dominant hand. So I'm going to pinch the outside of the glove and slide my hand on the inside, making sure I'm not touching the outside, getting it contaminated. So now I'm going to slide it the inside and slide my hand through there. Okay. So now I'm ready to clean the wound. I'm going to take dry gauze, and I'm going to clean from the least contaminated area to the most contaminated. And the inside is typically considered the least contaminated. So I'm going to start there. And I'm only going to use one piece of gauze per swipe. So now I'm going to take a piece of wet gauze. I'm going to open it up. I'm going to fluff it to pack the wound. And I'm going to have my Q-tip applicator. So I'm going to apply some light pressure to avoid causing the patient any kind of pain. And if the patient needed some pain medication, I would make sure to give it to them 30 minutes before changing the dressing. And I'm going to keep my dressing level with the wound bed. I don't want any hanging over the sides or anything like that. Okay. So now I'm going to take a piece of dry gauze and just lay it on top. I'm going to take my ABD pad. And then I'm going to take my piece of tape that had my initials, my date, and my time. And then any abnormalities or any kind of pain or anything like that, I would report and record.